So I lived in Las Vegas previously. I did my medical school training here. So from 2012 to 2016, I was here prior. I moved out to Michigan for residency and fellowship training, and then wanted to come back this way. So at Toro, it was a great experience there. You know, when I did my training there, we were the only medical school in Las Vegas. So we were there wasn't a lot of residency programs here, so you got a lot of hands-on experience, one-on-one experience with physicians that you don't typically get in medical school. So that was quite beneficial, I think, to my training. I'd always had an interest in science and math. Those are always some of my, better subjects and things that I always found interesting. As a physician, you get to interact with people, you get to talk to people, you get to help with them, critical points of their life when they're not feeling well, to try and make them feel better. Just do what's best for the patient. Right? Do what's best, what's going to help them out, especially in the long term. A year from now, I want them to be better than when I first see them. And just helping them through that journey of getting better. Taking the time to listen to them, to understand what exactly are the hurdles to overcome to get them to where they need to be. Even with the same pain condition in different people, they're going to respond differently to whatever kind of treatments, and trying to tailor that to them, to their response and how they do is kind of one of the challenges in pain medicine. There's not a good oh, you have this pain condition, we're going to do this. It's oh, you have this pain condition, this works oftentimes, but sometimes it doesn't. We got to try the next step and the next. So you have pain, there's a whole array of procedures and therapies and medications that we can try, but sometimes they don't always work, and you got to try the next one. In pain management, you got to be sometimes a little careful with who you're going to try to work for. You don't want to go into a practice where they are kind of feeding addiction sometimes, and you got to be a little bit cautious with that. And you also want to go to a practice where you can have time to spend with the patient and do the procedures appropriately. You need a certain amount of time. You can't just go in and do something real quick, And a lot of the places I talk to, it seems like they expected you to do things very rapidly, but then, they're making more money, but then they're also not, I don't think, doing what's right for the patient. And it seemed like when I talked to Dr. Kim in here, he seemed more to care about the patient, do what's right for them, take the time if you need it. Meeting the people, seeing what the needs are, and how best I can fit in to help them. Further my training with some of the latest techniques. I'm always going to have to be learning these things as they come up, to offer patients, better procedures with quicker recovery time, less complications. That's kind of what I'm looking forward to.